Since changing the name of the Eclectic Americana Friday morning drive time radio show on January 20th, 1989 to the Bushwhackers Breakfast Club, the DJs in the collective have strived to entertain and inform our listeners. Airing from 6 to 9 a.m. Pacific at KZSC 88.1 FM in Santa Cruz, California, the Bushwhackers usually have 2 interviews a week, each airing for about half an hour. We're not afraid to ask questions or admit that we don't know something, and we don't mind taking deep dives or following a tangent as we get into how sausage is made in local, county, or state politics, or learning about things going on in our community, or discussions with artists. Our interviews are not scripted and are produced by myself, Dangerous Dan Orange. I'm Dangerous Dan.
I'm Sassie Cassie.
I'm Kaos.
And I'm Gail.
Gail Newel is our Santa Cruz County Health Officer. Today was going to be your last day, but you've got, another week or two?
I'm off for the next 10 days, and then I am going to come back and overlap with the next health officer for 2 weeks, make a transition period.
So that was on the front page of yesterday's Sentinel, which I must have left near my dishes this morning as we were leaving, and it was dark out. Who's replacing you?
Very excited to announce that Dr. Lisa Hernandez is coming to join us in the county of Santa Cruz. She's been our health officer before, 2012 to 16, and then moved on to the city of Berkeley, where she's been health officer, but she's very excited to be coming back to county of Santa Cruz and be a county health officer again. So we're really happy to have her.
So, Dr. Gail Newel, you have been our county health officer through the pandemic. You joined us in 2019, not knowing that there was a pandemic right around the corner.
Correct. I thought I was going to retire, kind of slide into retirement in my home community. And little did I know, a few months after starting in July, that I would become the queen of COVID.
But you had some excitement then.
Absolutely.
And ended up with a few moments of fame on, you were on NPR, if I remember correctly.
I was. This American Life.
This American Life. All about being terrorized by people in the community, people picketing outside your house. Oy, 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 oy. But, okay, you've been on Bushwhackers before. This is the first time we've had you here in the studio, and I was tickled that we got to share a hug just before we came in here because we owe so much to you. I mean, you had to make decisions with impartial, imperfect data, but you had to make decisions. And so what I want to do is take our half hour this morning, do kind of a deep dive into COVID. What did we learn? What didn't we learn? And such. But I'm going to start by reading from the Sentinel back in May when they announced your retirement on the front page. You began your career in clinical practice, serving and also served at UC San Francisco as an associate clinical professor in the Department of Obstetrics and Gynecology, something you share in terms of an expertise with the person taking over. You later served as a medical director for the maternal, child, and adolescent health at Fresno County Department of Public Health, and as San Benito County's health officer, thinking in 2019 that you were going to come here and retire in your community. Well, I was going to say, how'd that work out? Well, let's start with that. Okay. Overall, Gail, how do we do? If you were going to give us a grade as a county, what grade would you give us?
We get a solid A.
Woo!
Okay, I'm patting myself on the back.
Thank you to the community. When you look at one measure of success during the pandemic, and maybe the most obvious and measurable measure, it's how many COVID deaths did we have? How many Santa Cruz County residents died of COVID? And we've been at the total number of 276 now since November. We've had no COVID deaths since November, which is a success in itself. But when you look at our overall rates, San Mateo edged us out just a touch, but otherwise we're the top of the state. And our death rate overall is less than half of the state rate and less than a third of the national rate.
Wow.
How do you prepare for something you can't predict?
Well, In public health, we practice pandemic response year after year after year. So we do drills with our hospitals and our emergency response teams and our medical reserve corps, which is a wonderful corps of community volunteer nurses and physicians. And we try to be ready for whatever might come up. But of course, this was a brand new virus, and we had no idea what was headed our way. So we often talked about building the airplane while we flew it.
Hang on, let me come back to the headline, giving ourselves an A, that our mortality rate in the county was less than half that of the state, and then a third of that of the nation. To what do you attribute that to?
I attribute that to the community's willingness to do whatever they could for themselves, their families, their loved ones, and the greater community. And when I say whatever they could, we didn't always know what was best, but when we asked the community to stay home, you all did. And when we asked you to put on masks, you mostly did. And when we asked you to get vaccinated, you mostly did. And it's those kind of measures to protect ourselves and our community that lowered the death rate.
Okay, I'm a scientist. You're a scientist. Cassidy's a budding scientist.
Crossing fingers.
Crossing fingers.
I'm an anthropologist.
Yeah.
Cool.
Going to keep us humane. Right. Do whatever we asked you to do. Stay home, wear masks, get vaccinated. In hindsight, the one of those that really mattered in terms of mortality is vaccination.
Probably not.
Really?
Okay.
Probably it was the very early stay-at-home order. And I want to give full credit to my 13-member health officer group of the Bay Area. It's called ABAHO, the Association of Bay Area Health Officers. And together, we made the tough decision to do the nation's first stay-at-home order, or shelter-in-place, we also called it. And after that, after the Bay Area order, Governor Newsom followed 2 days later, and then the nation followed the following week.
So the Bay Area counties, it started from the counties, from the bottom up, whereas the rest of the state started 3 days later. So it was March 16th versus March 19th, 2020, when Newsom did the top down. And it did look like there were differences early on, but those differences really disappeared after about May of 2020 in terms of the bottom up and the top down counties. But then, so I hear you, maybe stay at home had an impact in terms of slowing the spread. And I think in the early days of the pandemic, when we were seeing hospitals getting close to being overrun or close to capacity in terms of the intensive care units, that really was important at the very early days.
And we didn't have vaccines or therapeutics in 2020. Mm-hmm. So we didn't know how to treat people that came to the hospital.
Right.
We did it wrong for a while.
Right. I can't even remember the ivermectin or I can't even Paxlovid. No, that was the one that worked. I can't remember. I can't
all
keep
the
all these straight.
ventilators and
yeah, we
everything
overdid it with the ventilators.
Mm-hmm.
But I'm pulling this from a March 2022 David Leonhardt article in the Times. Do COVID precautions work? Yes, but they didn't make a big difference. And there's a graphic that really tracks red states and blue states, and within each of the states, the counties that leaned more toward Trump, which you could argue were kind of the obviously those are the redder, and the counties that voted more toward Biden, those are the redder, and the red states and the blue states and the counties within the states all show very similar rises and falls in cases, and we saw that in California as well, that all the counties would track together, but some counties like San Diego would have higher peaks, but they kind of followed each other. The peaks followed each other, but the difference was in cumulative mortality, where the red states and the red counties within those states had significantly higher mortality than the blue ones. So the suggestion there is maybe masks didn't have a huge impact, but vaccines did.
Absolutely. Vaccines, much bigger impact than masks. And I was a mask skeptic for a long time. I just couldn't see how little microscopic viral particles couldn't get through a cloth mask. It was basically like bugs and chicken wire. But, as a metaphor. But it did turn out that masks, even cloth masks, do some good because they stop droplets. Mm-hmm. And the virus was carried in droplets. So when people sneezed or coughed or talked loud or sang or yelled, the droplet spray would get interrupted with those cloth masks. So they do something. And then the medical grade masks, still, I'm very convinced that they do good things.
Right. So if you're a professional or you've been trained professionally to put on a mask, it does make a difference. But Leonhardt put it this way: imagine you carry around a 6-sided die that determines whether you contract COVID, and you have to roll it every time you encounter an indoor space with other people. Without a mask, you get COVID if you roll a 1 or a 2. With a mask, you get COVID if you roll a 1. So if you bump into enough people enough times and you're not a professional with a professionally fitted mask, it is the mosquitoes and chicken wire. And so that might be why the peaks and the falls all tracked each other. But within our county, Aptos and Freedom always had much higher numbers of cases than Capitola, Soquel, Santa Cruz, Scotts Valley. To what do you attribute that?
Freedom, I might say they live up to their name and exercise their personal freedoms a little bit more than some of the other mid-county. Aptos, I don't know.
Do you think that pre-existing health conditions and poorer areas that don't have as much access to healthier foods or as much health
lifestyle
stuff,
yes,
impacted the death rates in regions like that, especially because a majority of the United States is rural areas that don't necessarily have daily grocery runs or anything like that.
Right. Absolutely. Yeah, we call those social determinants of health. So where income and social status is very closely tied to health outcomes. You can even look at certain zip codes and their income level and predict life expectancy. So in my home county of Fresno, where I came from, I often bring up this example. There's 2 zip codes that are a 10-minute drive apart. One is west of Highway 99. It's almost all communities of color. It has only about a 10% high school graduation rate. Lots of negative social determinants of health there. And then a 10-minute drive away in North Fresno is a very affluent zip code. They have a 30-year difference in their life expectancy.
Holy moly.
Yeah.
And in more populated areas, there was also more testing sites and vaccination areas in the wealthier communities.
True, because, and initially especially because there's very few dispensing pharmacies in the South County area. So the pharmacies that were willing to vaccinate were all located in Mid-County and North County. So what we did was ensure that Salud para la Gente, Watsonville Community Hospital, our Watsonville Health Center, the county health center there, all had robust vaccination programs. And we are very proud of our primary vaccination rate, where our poorest quartile areas with the lowest socioeconomic status got vaccinated higher than our most affluent.
Oh, good.
Which is flip of what you expect.
Yeah.
And we have been held up by the state as a unique example of making that happen.
That's great.
Once again, Santa Cruz.
Give ourselves that. Mm-hmm. That's got to make you proud as a county health officer.
Yeah, I'm very proud of that.
I just reached over and patted her on the back. If you're just joining us, folks, it's KZSE Santa Cruz, the Bushwhackers Breakfast Club. We're talking to Dr. Gail Newel, retiring health officer. Attention! Of Santa Cruz County. I'm Dangerous Dan.
I'm Kaos.
And I'm Sassie Cassie. Gail, as someone so I started my global health degree in the middle of COVID. So let me tell you, when all of my intro classes were going, and we have a perfect opportunity to talk about what we're learning right here in the real world, in classes and everything. And one of the things that we really, really dived into is preparation, and how the health community and the public health community were talking about this is something that's been coming for a while, and we knew it was coming, especially with global travel and transcontinental discourse and commercialization and people moving around with our increasingly global community. And my question for you is, now that we have gone through a pandemic and we've seen what exactly our kind of new world, in a sense, has done to disease spread, what are things that the health community is doing now for future so that we're not going to have a huge pandemic again, at least in closer years, shall we say?
Mm.
Great question. And are there more viruses out there? Absolutely. I've heard from the World Health Organization that there's 4 more coronaviruses just poised and ready to make a global debut in Southeast Asia alone. So it's inevitable that there will be more. And COVID-19 is not unique in that. If you remember, we've had SARS and Ebola and even H1N1 that were all worldwide pandemics and didn't have the impact of COVID-19, but we will have more.
Spanish flu was pretty intense.
Absolutely.
So we heard all about the mRNA vaccines, the reasons those worked, and the reasons they were so fast in coming online. We had a vaccine within 6 months. Was because of SARS and Zika that federal money had gone into the development of a new type of vaccine, an mRNA vaccine, to combat Zika. And they were already in clinical trials when COVID hit, which is why they were able to pivot to clinical trials for COVID on a dime in January or February of 2020, before the medical emergency was declared. And I should just remind everybody, the medical emergency was declared in I believe March of 2020, and the emergency was not declared over until May of this year. Over 3 years in a medical emergency. So vaccines, the vaccines worked. I was digging around here. I grabbed an article from the paper yesterday that 13 to 15-year-olds nationwide have shown zero progress on reading and math, and in fact have gone backwards in the last 3 years. So as a health officer, Gail, you have to balance costs and benefits. And it looks to me in hindsight that the cost of taking all these, kids, and Cassidy was one of them, and throwing them into distance learning, that kids who had means and who had bandwidth and who had support in their family and parents who would tell them to do their homework and do their reading, those kids may have been able to kind of keep pace with what they otherwise wouldn't be. But nationwide, we didn't, and the mental health cost has been immense. So in hindsight, could we have done it without shutting the schools down, without going to 100% distance learning for years, in terms of the costs that this impacted on kids?
A short answer is yes, but let me expound. Again, at the beginning, we didn't know what this virus was about, and we were very concerned about death rates based on what was happening in the rest of the world. And we didn't have therapeutics or vaccines at that point. So I think it was reasonable in 2020, in the spring of 2020, to close the schools while we got a handle on this. By the time we had vaccines, December of that year, January, and I agree with you, those vaccines had been in development for 10 years. So when people say, I'm not trusting a vaccine that's that new, it wasn't that new. It was just
not everything
customized for COVID. Right.
Yeah.
And so I believe that by the middle of the next school year, or certainly the next fall, we should have had the kids back in school full time.
Just to clarify, this is September 2021?
September 2021.
Yeah. So one year of pause rather than 2.5 or 3.
Yeah, or 1 year plus a couple months, that first school year. And the health officers advised, at least I can say the California health officers strongly advised the governor's office that take place, that the kids go back to school in the fall. But there were there was a lot of fear in families and in the school systems, the educational system, about that. And the labor movement really was hesitant about bringing kids back to school. So the teachers union and SEIU that support the schools, bus drivers, et cetera, a lot of fear about going back to school.
Dr. Ezekiel Emanuel, one of Biden's advisors on his transition team, said, quote, one of the things we've learned is that we close schools much longer than other countries, and we've had this terrible impact on educational attainment, and we've seen the test scores go down. So, yeah, and this comes around to maybe messaging and the confusing messages that were coming down from the federal level that we were hearing at the state, the messages that you're hearing from the teachers union versus the public health officers. In terms of getting it right next time, how do we get clearer messages and convince the public that science is uncertain, but you can listen to it because it is science and we're trying to make progress. It's not perfect and we might contradict ourselves next month, but that's science. How do we get on top of this messaging thing that impacted vaccination uptake, which impacted mortality?
That's the big question, isn't it? In this whole country, I believe, in public health, healthcare, and many other areas beyond. How do we overcome this distrust of government and entities and science? I'm not saying the distrust isn't deserved, because certainly there's been a lot of dysfunction and corruption in all of those systems. But somehow we've got to get the country back on board with basic public health and healthcare tenets.
Hear, hear.
To go back a little bit to something that Dan said earlier, is there something that because mental health was severely affected, not only with just students, but with everybody that wasn't used to being isolated for such a long period of time, is there something that like the public health is doing in order to like support more like mental health, like mending or something that is like accessible for more masses of the public?
Well, one of the things we're doing is getting ready ourselves. So if you remember, we in Santa Cruz adopted a Save Lives motto, and each of the letters in SAVE stands for a different step that we took during the response. S was slow the spread, so that's all we could do at first. We did our shelter in place and our masking and social distancing, and then A was adapt. So as we got used to living that way and then developed ways of treating COVID and preventing COVID. V is vaccinate, and E is where we are now, and that's elevate readiness. So we do have a little bit of a bigger budget than we did before COVID in public health, Not what we need or want still nationwide, but it is a little bit more robust. So we're doing our best to try to get ready, and part of that is rebuilding resilience in our own workforce and readiness.
You had one other secret weapon, a logo, a brand, the screaming hand. In March 2020, wash your hands. It was everywhere. It was fantastic. You walk into the county building, and the screaming hand was right there on the floor.
With a mouthful of soap.
With a mouthful of soap. I don't know how you did that, but that was brilliant.
That's great.
So we got just a couple of minutes left. It's KZSC Santa Cruz. We're talking to Dr. Gail Newel, our retiring Santa Cruz County Health Officer. We've got the KPFA Morning News headlines coming up in just a couple of minutes. KZSC Santa Cruz Bushwhackers Breakfast Club. I'm Dangerous Dan.
I'm Sassie Cassie.
I'm Kaos.
Okay. So, yeah, when the pandemic hit, the country had 13 million N95 masks. As of May, we've got 352 million. Maybe we are a little better with that. Okay. Looking back now, we've got just a couple of minutes. And what would you do differently if you could go back? Not that I ever want you to live through this again, but if somehow we ended up in a time machine like DJ Kai Dragon, okay, if you went back, what would you do differently?
I think you honed right in on our biggest area of long-term consequence, and that's our families, our children and our families. That younger generation, it's going to take a lifetime for them to recover from this 3-year blip in their early childhood development. And we've got a lot of work to do with that younger generation. So I would have put more emphasis on our kids, on mental health, on family strengthening, building resilience. Not sure how that would have looked, but looking back, that's where our biggest gap is.
And looking forward, we've had Delta, we've had Omicron. There are new variants out there. As the outgoing health officer, I think you're still telling everyone, if you're not vaccinated, go get vaccinated. If you are vaccinated, get boosted. And if you've already been boosted, keep an eye on what's coming out from the CDC, because annual boosters may be the rule going forward, because COVID's not going anywhere and it's continuing to go through, these variants.
Yeah, I don't think it's going to be a rule. I think we're past the rule stage for COVID-19, but I do believe there'll be an annual COVID vaccine offered. So when you get your flu vaccine every year, you'll probably be getting a COVID vaccine as well.
Dr. Gail Newel, are you going to be working on your golf game, your Frisbee golf game up at De La Viega?
No golf for me. I'm going to try my hand at writing. So look at the letters to the editor, look for me there, and maybe some other places as well.
And tear out the rearview mirror, right? Thank you so much for everything you've done for our county, for keeping us with, as a beacon for the state in terms of mortality and how we did it, for reaching out with Salud para las Gentes to get, the reluctant, South County part, not only up but ahead of the rest of the county. Thank you, Gail.
Thank you to the community for your support the last 4 years of my work here, and it's been a privilege to be your public servant.
You've been listening to a podcast from an interview on the Bushwhackers Breakfast Club on KZSC 88.1 FM in Santa Cruz, California. This interview has been produced by myself, Dangerous Dan Orange. KZSC is a student-run college and community non-commercial educational radio station broadcasting from the UC Santa Cruz campus. You can stream KZSC online at kzsc.org. Thanks for listening.